Want to welcome everyone to the April 28th NEMSIS V3 implementation call. We appreciate you being with us this morning. Just as a reminder, these videos or these meetings are recorded and they are available on our website and on our YouTube channel for you to refer to later if there's a section that you missed and you want to go back over it, or if there's pieces of some of the meetings that you want to share with other members of your team. Those are available to you on our website and also on our YouTube channel. We've got lots of people with us this morning. Thanks for joining us. I'm going to go ahead and go down to the agenda for today. We'll start out this morning with a maintenance update from Laurel Baeder.
Hi, everyone. Good morning. Quick maintenance update is that our maintenance last week was successful and we were able to complete all the server patches we needed. And there should be no issues. If you're encountering any issues with NEMSIS services, please let us know and we will take care of that as quick as we can. If you have any lingering questions about NEMSIS maintenance or IT things, please feel free to shoot me a message in the chat, or at any time, you're more than welcome to email me, and you can find my contact info on the NEMSIS website.
Thank you, Laurel. Are there any questions for Laurel? All right, we'll go to the next item. And this is an ET3 update. And we have John and Neil with us this morning. Do you guys want to chime in and give us an update on the ET3 project?
Sorry, ma'am, this is Lieutenant Neil Milan. I was just getting on audio, so I heard the last bit of ET3 project, so I apologize for being late here.
No worries. We're happy that you can join us.
Yeah, this is John. I'm here. Can you hear me?
Yep, sure can.
Okay. All right. So, Neil, I'm going to start out and then you can finish this up. I don't really have a lot of updates. We are going at a pretty good clip in terms of getting folks onboarded this week, and really started midweek last week. There's a big push, in other words, to meet the April 30th deadline. Currently, we're seeing we're over 2 million PCR records that we've been able to receive thus far since January. So we are seeing a pretty good clip. We're over 120 folks that have actually requested roles that is representative of the users that are actually holding roles of API key requester roles. Obviously, our count of 184 participants, we need to get those up so that we can, again, be able to get everybody onboarded. So we're making efforts there to do that. We did hold a really successful Connect-a-thon last Wednesday. I just wanted to report on that. We pretty much had Kelly from ImageTrend bring a few of her agencies on. And we went through the entire hour just working out any of the issues that arose in terms of making sure that the connectivity is there. We also had a team available to do the approvals so that, again, all within one call, we can get those approvals through. And I would say that we had a pretty successful call. So this week here, we were wanting to line up another one. So if there are any of your, the vendors here in the audience that are interested in doing another Connect-a-thon, we are working right now to see if we can get Zoll in the pipeline. We've reached out to a number of other vendors to see if they're interested as well. So feel free to let us know. And we're pretty nimble in terms of setting up these calls. So we can very quickly, get our team together and get on the call and get all the participants that you are interested in getting through the process. We can get them through pretty quickly. So with that, I'm going to just stop. And Neil, if you have anything else that you want to share, I'll turn it over to you.
Yeah, thanks, John. Nothing in particular that I wanted to prompt. I'm certainly happy for any questions, any vendors might have on this. I know I've been out for a few days on leave, but happy to take any questions that you might have, especially for some of us who had some communications. I think last time we were on the call had some questions about the data disclosure, which I hopefully have addressed with everybody who sent me some emails requesting that material. But I'm happy to take a moment for any questions from the ET3 side, especially if it's something more related to the programmatic versus the more technical piece of the data submissions for ET3. Okay, hearing none. Thank you, Ms. Ehlers. It's over to you, I guess.
All right, thank you. Appreciate you guys being on our calls and keeping us updated on the ET3 model. Next on our agenda is Monet. She's going to talk to us just for a few minutes about state and vendor migration plans for 3.5.
Good morning, everyone. Can you hear me okay?
Sounds good.
Fantastic. I just want to talk a little bit about the transition from version 3.4.0 to 3.5.0. I'm going to share my screen. I think I need permissions. Let's see here. Okay, give me a second here. All right, you should be able to see the NHTSA website.
Yep, looks good.
Fantastic. All right. So a couple of weeks ago, I sent out a survey asking state managers to respond to 3 questions. One of the questions had to do with their transition to the version 3.5.0 standard. I'll pick on Utah since we live here in Utah and we're good friends with Felicia. And we've added the results of that survey to the each state page of the website. So it's here in the state V3 implementation timeline. And so it just basically gives us an idea of when the state has a plan for transitioning to the next standard. And we have not yet received information about when they'll close the 3.4.0 standard, but at least you do have some information here about, plans when they want to move the EMS agencies as well. So this relates to the question of who comes first, the chicken or the egg. Now, I'm not calling anyone chickens or eggs. We're just saying at this point, we have information from every state. So if you are very much interested in a particular state, all you have to do is click on that state and look for the information. Now, we want to also do the same thing with the vendors. We want to know when you plan to transition to the version 3.5.0 standard or have materials ready, have a product ready. We call it market availability. And we would like to be able to place that information in a prominent location where all the states can see it. And so I've sent out a survey a couple of times just to say, hey, can you respond to one question? I mean, it's really 2 questions because we want to know your software company, and then we want to get an idea of what your plans are. And if you don't have a plan at this time, that's okay. But at least we're trying to continue this conversation about when states will be ready and when products will be ready. So I'm going to add the survey to the chat again this morning. And if you can take just a few seconds to just answer the survey, then we will be, ready to go to the next level. Now, I can tell you here on this software vendor page that there's probably about 58 something. I mean, they're not all listed here, but if you're listed on this page, you definitely want to try and provide some indication of when you might be transitioning. And so I'll ask if there are any questions at this time. Okay, thank you so very much. I really appreciate.
Monet?
Yes?
Hi, this is Samantha with ESO.
Hi.
Quick question. So if we fill out the survey, where are you going to post that results for the data managers to see? Is it going to be public?
We're still making some determination about the best place where the information will fit. But once we have the majority of responses, because quite honestly, I think I have maybe 6 responses so far. But when we have a few more responses, Laurel and our leadership team will decide where the information will be placed, and we will certainly send that information out via the Google group to let you know how to look for that information.
Okay, thank you.
Samantha, this is Eric. Do you have a recommendation?
Well, I know that at one point we talked on these calls about like a list that you were going to create for software vendors with contacts that you were going to make available for the data managers. That was not going to be a public list. I was wondering if it would just be updated there. I'd have to go back and talk with some more people, but I don't know if we want it like on the compliance page.
Yeah, I don't think the compliance page is necessarily where we were thinking about. We have been working with NHTSA to create a partnership for NEPSIS, much like they do with some other organizations, and that might give us some other options. But I think the attended audience, correct me if I'm wrong, Julianne, I'm gonna step on my foot here, is all the data managers, the certainly the vendors, and then I think the state directors probably have an interest in this as well. So, you know, would you agree, disagree?
Mm-hmm. Yeah, I totally agree. And I'd love some input on whether or not that should be a file that we share off of the website and not post it. You know, in the chat, both James and Adam would love to see a sheet for what the states intend. And we do post that on the website individually. But from the vendor perspective, would you prefer not to see those plans on our website and just shared with the states? What are your thoughts on that?
Yeah, this is Clay. Maybe I'll restate that.
This is Samantha, and that would be mine.
So the goal here being full disclosure, the goal here being to distribute this to everybody and anybody who wants it without upsetting somebody because we included their information on it. That's really where we're at. So I have no problems with sharing it with everybody. I just want to make sure we don't upset someone in the process. And I know we will, because we always make 20 people happy and somebody's always upset. So.
Right. I'll make sure that I know that it'll be public when I fill that survey out. And that was really my question for that. Thanks.
Thanks.
Yeah.
Martha. Thanks for your feedback on that.
Yeah, thank you. This is Clay too. I like that idea too of the Excel spreadsheet that was mentioned by several folks, making that available in a more consolidated form for vendors. We can do that, and we'll do that. These lists, though, do get updated, right? So I think if you're interested in the most updated information, Monet is always talking with states, and states will have breakthroughs, or they'll have some bottleneck that's happened that requires that they move their estimates up a quarter or back a quarter within a year, you know, that type of thing. So for the most updated information, I think you'll always find that just on the website, going to each individual state. But we'll try to send out an updated Excel spreadsheet for state information, and we could include on that same spreadsheet the vendor information often as that changes. Thanks.
And Steve brings up a really good point in the chat as well. And this is part of the conversation that we're having with states too. It's hard to provide, you know, a definitive time for that transition because of, you know, of products and processes and setbacks. So, you know, when you look at the survey that Monet is sending out, you know, even if you're just indicating a quarter, Are you looking at, third quarter, fourth quarter, first quarter next year? Yeah, just like what Adam put in the chat, Q4 of 2021. So we're not asking anybody to make firm commitments. It just is, helping to inform both sides of the partnership with the states and the vendors, so that you're able to both meet those needs and those goals.
And Monet, this is Clay. Some folks are having trouble opening up the survey. It indicates when you click on it that it needs a password or a sign in. Can you check on that?
Yes, I'm working on it right now. Thank you so much.
Thank you.
Okay, we'll get that. We'll get that form link fixed, and Monet will put that in. Are there any other questions on transition timelines for either states or vendors? Okay. Then and going straight into the next topic, which is the sunset of 334. Let me share my. Let's share this. Okay, hopefully everybody can see that timeline. So we just want to keep keep everybody aware that the 334 sunset is August of this year. And there are still some states and agencies submitting data in 334. So as August approaches, we are happy to provide any support that we can to agencies or states to transition to 3.4 or 3.5. Of course, we'll promote transitioning to 3.5 because that will give you the longest time frame in being able to stay in a version. But if you need to transition to 3.4, we fully support that as well. So feel free to reach out to us if you need support, if you need help, if you're not sure where to start or what to do next in transitioning out of 3.3.4. We're happy to help. We just want to make sure everybody's aware of that timeline. And there's no plans to change any of those other sunset times on the timeline. Any questions for that? All right. And I have the next topic as well. As we're looking to coming into annual meeting this fall, we are open to suggestions for topics. We had really robust discussions last year, and it felt like we covered a lot of ground in those 3 days, those 3 half days of discussions. And if there are things that are on your mind or of significant concern that you feel would be a really good topic for this group, please let us know. We're happy to take those suggestions. Like the V3 implementation calls, the annual meeting needs to be productive and valuable for all of you as stakeholders. So we really are open to your suggestions and requests. I'll put my email in the chat. And you're always welcome to email any of us at the TAC, and we're happy to take those suggestions.
Yeah, Julianne, this is Clay. Maybe just a couple more comments, or this is really a great opportunity to kind of choose our topics and make sure that time is very productive. The boot camp that is being held as well before the annual meeting that is specifically directed towards state EMS data managers. That focus of the boot camp will mostly be on educating the folks about the transition to version 3.5.0. What are the kind of the important aspects or changes that are associated with 3.4 to 3.5 that could be communicated to EMS agencies within states? What's important for folks to know, what's not important for folks to know will also be important. So we're going to do our best during that time to bring all the states up that wish to participate in that boot camp really up to speed as to how best to transition in an efficient way. So we'll concentrate on that topic there during the boot camp. Maybe that will spur your thinking a little bit about what you think might be important topics for us to cover during the implementation meeting.
And we've got a bunch of the resources from last year's meeting as well. If those are valuable for you to review as you think about topics that would be meaningful, those are all available on NEMSIS 101 site or on the page. And then annual meeting resources. We've got lots of stuff on these pages as well for you to reference. Any questions for boot camp or for annual meeting? More information will be coming out for those as we finalize agendas and topics. But we do want to make sure that those are valuable to you. All right. It looks like that survey's back up and running. Thank you. And thank you, vendors, for being willing to fill that out. We appreciate that. All right, let's go back to the agenda. Next up is Eric. If there's topics or issues you'd like to share with the group, Eric, we'd love to hear from you.
Hi, good morning, everyone. Actually, Julianne, I have nothing specific. Well, I do have one thing. So we have been working with PWW, Page Book Worth, on a lot of different topics. The HIPAA guidance that's been put out. We have one more HIPAA document that's coming out. We've been talking about body cams, and we will be talking about storage of videos as a part of the patient care report and providing some recommendations and some guidelines on those types of things. One of the other initiatives that I've started is to ask about data ownership to determine who actually owns patient care reports and data and how far up that can be shared. And when it goes from the next level to the next level, what is their responsibility, and can they basically change tack and share it with someone else, and so on and so forth. So there's a lot of talk and a lot of concern about sharing data now as we start to work with not just HIEs, but as we start to work with the billing agencies, CMS, CMMI, on projects like ET3. I feel pretty comfortable with the work that we're doing there, don't get me wrong. But I want to make sure we have a clear understanding of that. And that's something that in all of the paperwork that I have received when I took over this project at DOT, there was really no guidance on that. And there had not been any written direction on that I can find since the beginning of the project. So, if people have thoughts on that, by all means, happy to hear them. Send me an email. It's not going to be something that's going to happen in the next couple of weeks. It'll be over the next couple of months. And if anyone has other projects like we've just discussed, that might be of value to have someone like Page Book Worth or another outside entity take a look at them, happy to entertain those as well. Our data use agreements that we've discussed, that ties into the project that I've just mentioned. We'll be using Page Book Worth to basically draft a new data use agreement for us to start to disseminate and work with the states to get that signed. So all of that's going to be over the next probably year and a half. But I wanted to let you know about the project and offer up the opportunity if you have others and think that they would be of value to all 50 states or a big portion of the states. I'm happy to hear them and take suggestions. But thanks.
Thanks, Eric. Any questions for Eric? All right. Are there any questions, concerns, comments from any of the participants today?
Hey, Julian, this is Clay. I'll just remind folks we have a work group that will be meeting tomorrow in regards to really trying to finalize the e-outcomes process that is going to be associated with version 3.5. So how we get the e-outcome section data from an hospital EHR back up into the medical record on the EMT side or on the EMS side. So there's a great group that's associated with that. Call vendors as well as state data managers. Folks will know we're kind of very focused on working with IHE right now. And Andrea Forquette is working on an amendment to an existing profile they have that is related to moving outcomes data back to EMS. And there's a new volume 4 that will be developed that is specific to the US realm. And we also have been given permission to add what we think will be kind of a template for the e-outcome section. And so that's what this group is working on, is formalizing that template to be included in that volume 4 of that update to that profile. So if you have interest in participating in that, but I did not receive a calendar invite, feel free to reach out to me. I'd be happy to add you to the list. That call is tomorrow at 11 a.m. Mountain Time for an hour. Thanks.
Thank you, Clay, for adding that. We've got a couple of other upcoming events that are listed in the agenda. We have a public training next week. Josh Leichler is going to present that for us on StateDataSet, dashboard tools, best practices. We've received a lot of questions from states on StateDataSet, and Josh is going to help walk us through some of the tips and tricks for that. And that's next week. Boot camp will be coming up July 13th, and that will be specific for data managers. And then annual meeting is in August 3 through 5th. And both of those will be virtual. Although we are terribly sad to not be seeing you all in person this year, we opted for virtual again this year just to be extremely cautious. So those are coming up. We'll have more information available. Our next V3 meeting is May 12th. I can't believe it's already May. That's just crazy. But it is in a couple of weeks, same time, same place. And as always, if there are topics or issues that you'd like to bring up or have us address on the V3 implementation call, just let us know and we'll get those added to the agenda. Wow, short meeting, you guys. You get lots of time back into your day. That's pretty awesome. Thank you for being with us this morning and taking time out of your day and participating. These calls have been immensely valuable. Thank you, everyone. And
hey, Julianne, hold on 1 second. Before you cut everybody loose and before everybody runs, since we have a couple minutes. How about concerns, things you want to complain about, things that aren't working well for you? I would love to hear some direction on things you think maybe we should be working on, things we shouldn't be working on, but we are. This is an opportunity to, tell me what you think, and I'm more than happy to listen. And silence means that I've made all 50 states and 4 territories and tribal nations happy, which means I can go to sleep tonight real well. But no, seriously, and if people don't want to say anything in this forum, we've been working with this internal and external sort of advisory board, I call them, and talking about sort of the future and next steps. And I've been working on a presentation kind of behind the scenes that I'd like to do for the state directors, and certainly invite this group and just kind of give an overview of NHTSA and where I see it. We've been really working to try to secure funding, and I've said many times, I think that funding needs to be at the state level for state programs. That's kind of a piece that we're still continuing to work on. This administration is really focused on safety and safety issues, especially in DOT. So that's an opportunity for us. And then within the providers themselves and the EMS agencies themselves, my focus, and I just had to put these together for several teams, or not for several teams, for several different documents that are going through DOT right now. But anything that has to do with workforce safety, I'm getting emails almost every other day now where someone was assaulted in the back of an ambulance. We had one the other day that was on EMS1 about someone who pulled a gun in the back of the ambulance and actually fired shots. To me, and it's anecdotal, and Clay and I've talked about how to get at this a little closer, the environments we work in are becoming far more violent. And I'm worried about the safety of the EMS personnel. Of course, behavioral health and mental health coming out of COVID, I don't see that getting better. And then just overall, where are we at with EMS monitoring the workforce? We spend a lot of time at NHTSA talking about patient care. Most of our requests are specifically about patients making better care, providing better care for the patients and such. But I think we really need to start spending a lot more time on the operational piece. Not about evaluating operations within an ambulance service or within an entity in a state, a county, or location, but about, are our providers numbers going up or down? We see emails, we receive emails, and then we receive news articles, and there was an article in the New York Times about failing volunteer services and failing services in rural areas and services not getting the money that they need to sustain themselves. Is NHTSA something that should be used for tracking that operationally? And if so, how is that accomplished? Some people would say that's not the role of NHTSA, others would say it clearly is. I fall in the middle. I'm trying to sort that out, but just want to make sure that we're clear on something, that if it doesn't come from that, what is the other source of that data? I would love to be able to track how many times a provider is assaulted in the back of an ambulance. And I don't need 50 different drop-down elements or 50 different elements with 22 drop-down things in each list. I just want to know that a provider was hit, spit on, kicked, a knife pulled on them, shot at, or something. NHTSA, the National EMS Advisory Council, spent some serious time looking at elopement, people jumping out of the back of ambulances, which is interesting because a lot of the news articles that are out there now are about people stealing ambulances and taking them for joyrides. So I guess my question to some of the vendors that are on here, and we'll be talking with the data managers a little bit more in depth on this, is how do we capture these things and paint a good picture of what the true environment looks like for the EMS personnel in the United States? So just kind of my thoughts. You'll hear a lot more of those as we move forward, but please, if you have ideas or things that you think we should be working on, I can guarantee you send them to me. They will be read and taken into full consideration. At this point, don't let the money piece scare things off. I'm more interested in the idea, and if it's valued and we need to do that, we'll find the resources somehow to get it done. So thank you all very much for the work you do. Appreciate it.
Thanks, Eric. There's a couple of comments in the chat too. Karen shared an article, and then Benny just had a couple of questions about, what's the goal or the purpose, and then how to use the data afterward. Any thoughts on those?
For which specific topic? I mentioned quite a few. I'll use the one for violence. So the one for violence against EMS personnel. I think there's a lot of discussion about what personal protective equipment EMS personnel should receive. Should they wear body armor? That's kind of the extreme to me. Should they wear, should they have? In some places there's been talk about EMS personnel carrying guns. In some places I think they do. So I think to me that data goes to, one, show the true environment that they work in, two, provide them with education, like how to avoid situations where they get hurt, how to actually assess your patient, and then in some cases, I think, pat down your patient to make sure that they're not carrying any weapons. If you are trapped in the back of an ambulance with someone with a knife, how to get away from them successfully. And then just what to do when someone is in that situation. You step out, wait for law enforcement, run. Is that abandonment? I think there's a lot of questions here that would come up if you really sat down with a group of people who are in that environment on a daily basis. And I am clearly not one of them. That's been years ago for me. But I can't help overlooking the articles that I see almost every day. And I don't know what to do if someone steals your ambulance. I guess you just Uber back to the station. But that for whatever reason, that seems to be the hot ticket. You know, stealing an ambulance and going for a joyride.
Any other questions for Eric, or weighing in on that topic?
This is Karen. I'll just ask a couple things really quick. Does NFIRS capture injury data specifically for fire personnel?
Yeah, they do have so I don't know if it's a part of NFIRS or it's a side piece of NFIRS. They have the firefighter close calls types of things that basically report when a firefighter is I think it's either injured or almost injured as a part of an incident. And I'd have to look at it. It's been quite a few years since I've looked at it at Navy Fire. We also tracked whenever, for example, in the fire service, it wasn't through NFIRS though, but I think part of the data went to NFIRS when a firefighter was injured. And this was kind of a weird thing. One of the things we saw was it was a system called IRTS, Injury Reporting something within the Navy. It was one of the DoD acronyms. Firefighters were getting hurt falling out of fire trucks, which for an EMS guy, you can kind of smile about. And we did this long investigation to figure out why firefighters were getting, and it was happening quite frequently. What we found out was it was out of ARF trucks, the aerial rescue fire trucks. And when they were built, they had a very small step at the bottom. The steps were actually on almost like a triangle. And the one at the bottom was only about 6 to 8 inches wide and only about 5 or 6 inches deep. And when you stepped out of the truck, the first two were pretty big, but that last one was pretty small. And in boots, there wasn't a lot of place to put it. So that's an example of how we looked at injury data and made recommendations for changes to a couple of fire trucks, the styles of fire trucks that we bought, and really reduced injuries for personnel. So yeah, I mean, we can certainly learn from some of the work that the fire guys are doing as well.
Thank you. I guess the other thing I was wondering is we do have the element, about the crew member group. There's type of work-related injury, death, or suspected exposure. Is that something where values could be added? I mean, as opposed to adding a whole new element to capture something like that?
Oh, certainly. I think you could beef up that section quite a bit. The question is, and someone asked us, I think this goes back to Samantha's question, is what are you looking for? What are you going to use this for? Are you looking at it from an injury prevention perspective, a public health perspective, just protect myself perspective? I think those are the questions that you would have to ask when you start to look at these data elements. And, these are just the thoughts that I have when we're sitting in meetings, and I make notes, and I've got this long laundry list of things that I'd like the NHTSA TAC to work on. But I can't say this enough. I'm one person, and many of you have worked in this a lot longer than I have. And I really, really rely on your input and the things that you send in, and spend a lot of time talking with Clay and Julianne and then people in the field and people in our office to say, hey, look, has this ever been tried before? Has this been done before? What's important to the DIA right now at NHTSA? What's important? I have NAEMT's book laying right here on my desk. And it's NAEMT put out a list. It says NAEMT Advocacy Update. And it's the 2021 priorities. And I've laid the 21 priorities the 2021 priorities that they've identified next to my priorities to see how they align. And what's important, and a lot of theirs is, around treatment in place, which aligns with ET3, but it's kind of that next step of ET3. So when I have meetings with Neil and John, I push them every chance I get to try to make it clear that we really want to take that next step. That's just my thought process and how I move things through. But I can't say enough. I really want the input. So thank you.
Hey, Eric, this is Jennifer. The one thing I have heard brought up when we talk about injuries to crews, exposures to crews, and things that happen that way, the question that always seems to arise is about the crew privacy and associating it with the patient care report, those kinds of things. So I know that's one thing we might want to consider when we talk about adding elements or going to it, the drop down, or how we collect the data on whether it's actually a part of the patient care report, or maybe it goes into some sort of subset data set or something where it's not necessarily associated with that patient care report.
Excellent point. So anyhow, I don't mean to take up everybody's time. Just some general thoughts for what they're worth. Please, like I said, send me any ideas and things you have, and we'll add them to our agendas and start discussions on it. But thank you all. Be safe.
Thank you, Eric, for bringing up that topic, and thank you guys for participating in that. It's a good conversation and an important one. Barring any other topics to bring up. All right. I think we're good for today. Thank you, everyone, for being with us today, and we appreciate it. We will talk again in a couple of weeks. Thank you.